No service at any public health facilities. Nobody should be turned away.
So far, we are seeing island-wide where it's been said that less than 25,000 Jamaicans are fully vaccinated now. Does that provide a concern for you at the parish level?
As far as healthy parish produce more, I'm not overly perturbed though, because you could use that same situation in developed countries, including the great United States of America. The take-up is generally slow. What we have been doing is to sensitize those persons using phone calls, using Zoom meetings with Citizens Association, to use the areas that we have the captive audience, like the health centers, which we have 24 of those, and to the general citizenry through print and electronic media to show them the importance of taking the second dose and to ensure that they come in. If the 8 weeks would have passed, there are some persons who would have been reaching out to the health department if they are going to travel, other business abroad, that would have surpassed the 8 weeks, that they would have come and we would have assisted them in getting their dose as well. So we are a responsible parish, and we are ensuring that all persons in the parish that would have received their first dose, and to encourage those who are to get their second dose to come out and do so. We are not just relying on the areas that is the melting pot, like Montego Bay here, or the convention center or Sandals. We are taking the vaccination to the rural communities, those persons who find it difficult to come into the town. So for tomorrow, Monday, we will be in Adelphi. On Tuesday, we'll be in Mount Carey and John's Hall. The next week, we'll be in Maroon Town. So we are taking the vaccination to South St. James and other rural areas to ensure that all persons, they do not have a up to say we do not have the chance to come to Montego Bay. Because like in other services that we offer in primary health care, vaccination is also a primary health care responsibility. So we are taking the vaccination to these people. We have a register of all of these people at the different health centers. So who cannot come to the site, we use our mobile units to go to them and to vaccinate. We are thinking about all those persons.
I feel very good. Personally, I have had my first dose. I'm sorry I couldn't get my second dose now. Probably if I had taken my card I could have got it. But that's how it is.
And you said you're coming from St. Anne?
Yeah. We made some phone calls and we understand they will have a vaccination. The second, some form of vaccination here today. But it's also two-folded, so want to do a test to travel. And we understand they do that at the airport. They have done that already. So the trip is worth it really.
Persons are even coming from out of parish to get their either first or second vaccine here. What does that say to you, that persons are coming from outside of St. James?
It says two things: that we are open to the general public, that we should do as a health facility. Fact is, no service at any public health facilities. Nobody should be turned away. Nobody should be turned. And we're not. And this facility operates and takes persons from as far as Westmoreland. What we do, we encourage them after treatment to use their facility the next time. You would agree with me. There are persons who work in as far as Ocherias that works in Montego Bay, do business in Montego Bay. So as far as the economics is concerned, when they come, they want to do everything. And this is why we would have opened this health center to offer public health services up until 11 before the pandemic. We have 5 health centers that have been upgraded. A new brand in Adelphi. The Cashinal one that is being expanded. Upon completion, we will have the same services, extension of services, up to 11 o'clock. So we are facilitating those persons who work on shift, the BPOs, the hotels, and so that when they leave work, they still have time for us to offer them healthcare.
You had a set target during the previous blitz of 1,000.
Yes.
During the next blitz that is coming up
Yes.
later on this month.
Yes.
What do you have a set number target for that blitz?
We have the similar to target to vaccinate those that we have even exceeded at that time. We have made the plans just on Friday. My medical team and myself would have made those plans to offer similar service and to engage more as well the tourist workers who we want to ensure that they are fully vaccinated, because as you would have seen, based on the latest disaster risk management act that was given by our Prime Minister, beaches are being open, other facilities are being open. So we have to cater to these people that will interact with the public to ensure that they are fully vaccinated. You would have those anti-vax, you would have those persons who have not even made up their mind up. I have a small percentage of my own health workers who are doing their research. I had a meeting with them on Wednesday, and I'm sure that come tomorrow, those persons will be on board. We try to reach those persons, sometimes in groups in these communities. We were in Cornwall Courts on Tuesday. We're going to Pit 4 tomorrow to deal with those small group of persons who have concerns and to show them that nothing is wrong in taking the vaccine. Our health education unit has been working tremendously, and I want to thank them. We are out there, the community health aides, the 120 community health aides that were employed for this program. It is the best decision that I believe that our Minister of Health would have been taking. We are seeing the upgrade and the modernization of public health from 2016.